Welcome everyone to today's webinar. This is Drew Silva with the American Hospital Association, and I'm pleased to be moderating today's event, Understanding Your Patients as Consumers, the Shift to Consumerized Healthcare. Today's event is sponsored by Buxton. In every industry and every vertical, consumers have more choices than ever. What to eat, where to eat it, what to buy, how to buy it, what channel to buy from, the options are endless. Healthcare is no different. With the rise of social media, online reviews, and the internet, patients have begun to view healthcare just like any other consumer service. Empowered by choice and focused on convenience, they no longer rely on just referrals, but do their own research to find the providers they want and the access points that work for them. In today's event, we'll explore how healthcare organizations can start thinking of their patients as consumers to guide locations, marketing, service line, and other growth strategies. With that, let me briefly introduce today's speakers. Bill Stinneford is the Senior Vice President for New Client Growth at Buxton. He works with companies in the healthcare, retail, and restaurant industries to identify ways to apply Buxton's analytics and technology to solve their biggest challenges. Additionally, Bill is part of Buxton's executive team and collaborates with other company leaders on corporate initiatives. Bill has been a featured speaker at a number of retail, restaurant, and healthcare industry events and was honored as a recipient of the Fort Worth Businesses Press 40 Under 40 Award given to top rising executives in the community. Allison Lewis Lodhi drives support, growth, and partnership and digital transformation initiatives for Community Health Network as part of the business development team. Since 2015, she has provided leadership to various transactions, new business and product launches focused on digital health innovation and consumerism. She develops and executes enterprise strategic partnerships with publicly traded companies to early-stage digital health startups. Allison's 20 years experience includes startups, digital marketing and analytics consulting, and non-for-profit executive roles. Nick Parrish is the Vice President of Account Management at Buxton, where he establishes and maintains strategic partnerships with clients across industries with a primary focus on healthcare. He advises clients on the best way to apply consumer analytics to answer their unique business questions and co-leads a team of Buxton's analytics experts. Prior to joining Buxton in 2020, Nick was a General Manager and Director of Business Development at Variable. It is now my pleasure to turn the floor over to our first speaker, Bill Stinneford.
Thank you very much and appreciate everyone's time today. We're excited to have a roundtable here and a good presentation with Allison and Nick. So the agenda, we'll talk about the purpose of considering patients as consumers, the role that consumer analytics can play in that, lessons from Community Health Network that Allison can share, and then have plenty of time for question and answers. So excited to discuss this topic with you today. And Allison, kind of starting with you, this section, why healthcare organizations need to think of their patients as consumers, the impact of consumerism in healthcare. This is something that seemingly has been a phrase for a number of years, but would you say it's old hat for health systems, or this is something that people still can't get a grasp on, or is everybody a little bit different and it's sort of somewhere in between?
Yeah, right. All of the above, right? So I love this topic. I'm so excited to get to talk about this, and I'm so excited to not only share this dialogue here and then get into the questions and hear from others on the line, because I think, to your point, everybody is at a different place in this journey. I think most health systems at this point recognize that consumerism is here, and it's probably here to stay for a long time, and we've got to continue to evolve to meet that expectation. So what I would say is, at least from our experience, we've been talking about this a long time. I think healthcare consumerism has been a topic for certainly well over a decade, maybe longer. The intentional work within Community Health Network predates my tenure at Community. I've been there for 7 years, and it was already underway when I arrived. And so I do think we've been talking about it a long time. I think our sophistication in understanding the consumer has evolved greatly, and every health system is probably at a different step on that journey. But for us, it's been a constant evolution, and where you want to be and what you acknowledge is what you're trying to achieve, and where you are sometimes, part of the fun, right? Continuing to build and grow. Yeah.
Right. And it's funny, we have this sort of imagery here of a case, right, how would you describe this, right, as you're thinking about it? If you were a health system or health organization that's on this call today, what is important about this visual? Why did you want to kind of talk about it in this way?
Yeah, I think the key message, maybe we should have just titled this, "Please Start," because I think the
Right.
purpose, it can be really overwhelming. So really just taking some lessons from our experience in going back in time a little bit. Like I said, we're fortunate to have leaders who have been thinking about this for a long time. And so at the time that I joined the organization, our Chief Strategy Officer, is now our CFO, was very focused on this. It was baked into our strategic plan. It's been a part of our sort of DNA for a long time. But again, the aspiration for where you want to be and where you are is the work to be done. And I think it's really easy to get overwhelmed by this because it is such a fundamental difference in the way that health systems have thought about customers. And I think we should talk about that too in a minute. But it doesn't have to be everything all at once. And I think that's been our experience, is pick somewhere to start, do a great job, go deep there, and then go to the next spot. And so every organization is going to find that place that makes a lot of sense to them. It's going to be the natural, easy win, or easier win, maybe. But I think finding a place to go as a starting point is the most important, and then you just keep building. And so there are a lot of transformation type activities that really are enterprise level, and they need to even start at that point. And I don't see this as that. I think you can have an enterprise vision that you can execute in pieces, and you can win at consumerism in pockets and grow into this over time. So I think that's been our, at least from my perspective, key learning.
Yeah, I think that's important. If you haven't started or you're not, you have to start, right? But even if you are somewhere further along on the staircase, you have to continue to evolve because you have to continue to take your sophistication further and further. And then also, Nick, the consumer is continually evolving. And when this topic came out and really started being discussed seriously a number of years ago, what the healthcare consumer was doing then, it's obviously evolved greatly. Technology helps that, sophistication, people understanding that there's other things out there. So even if you are on one of these rungs that's not at the bottom of the staircase, you have to keep going, right? Because the consumer keeps evolving, and you have to keep pace with that, right?
Totally. If we were able to somehow, think about your own experience as a consumer in terms of retail or restaurant, right? If you were able to somehow screenshot the website or the app of your favorite or kind of most frequently consumed goods from, call it, 2018, 2019, even if they were really sophisticated, it looks better now. It does more now, right? Because those brands that figured it out, the good ones, said, oh, we should keep going because eventually not only will the market and our competitors catch us, but also the consumer expectation will keep rising. So, kind of the old adage of, everybody loves the Gretzky quote of, skate to where the puck is going. You have to be moving in order for that to work, right? You can't sit there with a clipboard out and try to calculate where the puck is going and then lace up your skates and start moving. So that idea of constant motion, and then I think Allison said something really important with kind of the staircase imagery, is that that can help keep you motivated and kind of on that journey, because it's not going to be an easy one, right? You're not going to wake up one morning and be like, we did it. We have succeeded at implementing. Yeah. Well, on to what's next, right? It's about a course that you get a certificate. So if you go into it, or if you're in the midst of it now and you're thinking of it as a journey and as a process, you'll be much more open-minded and optimistic throughout, because there's going to be challenges, right? Macro and micro level challenges. And so thinking about it as a process, that you're on a journey and you're working towards something and that's evolving, can help your organization and the individuals that are tasked with making that happen as well.
Yeah. And Allison, I think as we think about, things about customer and patient and consumer, how I think there's a huge opportunity for health systems in this when a patient is thinking about healthcare as a consumer, because there's really an opportunity, right, to talk to them and win them over from a brand standpoint, and we'll talk about that today. And that may sound, counterintuitive to health system brands and, things like that. But I think there's, the opportunity is to say to people today, hey, not only will I help you when you're sick, but I'm here to help keep you healthy. And it really becomes this cradle to grave type relationship, right?
Absolutely. And so, getting to where can you start, I can share where did we start. And I think where we really started to catch fire, if you will, on the understanding of this was really first taking a step back to look at, firstly, why is this so hard in healthcare? Why hasn't it been done up to the point where it started to become a topic? Well, health systems were built in a way to serve a different customer, which was an insurance company. That's who paid the bills historically, and the infrastructure around healthcare delivery and the provision of care was this thing we did to and for patients. And so they were kind of these two different categories of people or entities. And so the customer was the person who paid the bills, the patient was the person we provided care to. And these are broad, strokes, but I think conceptually, as you saw the rise of high deductible plans, and that's still happening, as you've seen the change in the landscape that Nick talked about, even of our consumer brands and the experiences we have there, and our expectations are higher around who should deliver what, and healthcare is the most important thing that we buy in our lives. So our expectations have increased, which of course means that our patients' expectations have increased. And that's where this consumer language, I think, I'm not a clinician, but I really can respect this perspective from a clinician's lens that a patient isn't a consumer, it's who I serve, it's who I care for. It was a hard shift, I think, for the organization, at least our organization, to make in thinking about the patient as a consumer, because we see ourselves as patients first. We're focused on quality, we're focused on exceptional care, we're focused on the patient experience. So what we had to do is kind of take a step back to say, okay, that's all still true. You don't have to let go of any of those things to talk about consumers. It's about taking a step back and say, we don't win the opportunity to serve that patient if we can't compete and be present and a great choice to the consumer who's never met us. So we started, while it is the same, patients who already are with us deserve an exceptional consumer experience too, but we found that kind of separating out and saying, hey, let's first just talk about who's never been here. What's that experience like as a consumer if you're trying to make a choice? And that became kind of a safe space for us to work on this and really address the new consumer as a place where, we want, of course, the opportunity for them to become a patient. And then from there, we were able to build and say, and obviously we want all of our patients who are going to continue to make a choice to pick us and be loyal to have the same great experience. So for us, that was a great place to start. It worked in terms of changing the way we were thinking about this. And then the last piece I would add to that is in the context of kind of where we are, so again, that was many years ago, we had a really wonderful gift from our CEO who created the space for this, who said, we actually set up a division at the time, a retail and innovation division, because we said we're going to focus on new and we're going to go where we can expect that consumers, these things are really probably most pertinent, which is in kind of retail healthcare. So as we were launching into retail care, consumerism was hot, and it was an area where we felt it was all new, and we could really do something new and powerful in that space. And so our CEO created a vision and just said, hey, the job of this group is basically to disrupt ourselves, and if they're not driving you crazy, they're not doing their job, because they should be questioning everything. Are we doing everything we can to really deliver on what the consumer wants and how they want us to show up for them? And so that was a wonderful gift that we had to work within, and it enabled us to, we're still learning and growing, but I think we really got some things right that we were then able to then extend across and still are working to extend across the organization. And so on the stair step, visual of kind of where we are, we keep climbing, but I think we've changed from sort of this two-dimensional concept of maybe reacting to opportunities and trying to do a better job at that, and we still have more to do there. But it's becoming now more three-dimensional in that now we're starting to think about the total journey, because a patient's experience isn't just a transactional singular care moment. We want to do a great job with that, but then the next experience needs to be equally as good and connected. And so that's the real complexity that we're working on, and probably will be for a long time.
Right.
There's something you said there, Allison, that really stood out to me. Is just that you kind of, shouted out that your CEO created the space for this to even be possible, right? Kind of created that vision. There's certain initiatives that you can do kind of grassroots and ground up and kind of bubble them up to the top and then, spread them throughout an organization. This pivot could work that way. But even if it's in a small but intentional way, creating the space and declaring like, hey, we are going to do this. This is a journey that we're going to embark on and we're going to see it through is huge. So for some organizations, they may not have even taken that step yet. That's the conversation that they're having, and that's okay. Other folks like yourself in community health may be further along that path and kind of evolving into new things. But kind of the another thing that you mentioned in terms of old way of thinking where it's waiting for something to go wrong and then we treat and serve the ailment and then get you back into circulation. New way is, hey, we're kind of being, more holistic and 360 around that. The consumer is already accustomed to that in so many other ways, right? So think about automotive parts, right? There's the one version where it's like, oh no, something terrible happened. I'm going to the mechanic or I'm going to an auto parts store because my car will not drive. There's the other version that says, I'm getting an oil change. I'm getting new wiper blades. We're topping off fluid. So kind of being there for the maintenance and the total care to prevent, or maybe in healthcare terms, right, early detection. How many times have we heard that? It's no coincidence that folks that are thinking about patients as consumers and as just humans living their day-to-day lives are probably seeing greater outcomes being driven in their service areas as well, because they're getting higher upstream and they're not just, having to encounter people when they're already in crisis. We don't have enough time to go into all the specialties where that maybe has more impact than others, but, mental health, getting lots of fanfare right now, maybe, between that and primary care, maybe the two most glaring examples of that. But I love what you kind of talked about there as kind of the initial train of thought versus now it's more of looking at the whole person, kind of full Jesuit style cura personalis there. So love it.
Yeah, and I think, there's just that alignment and from the top makes it so much easier to have that buy-in become so important. Another thing that becomes important to help make this be something that is efficient and test and learn and get smarter over time is consumer analytics. So Nick, as we talk about the impact of consumerism in healthcare, how can consumer analytics help?
Yeah, this is the day-to-day right here for me. So one of the most impactful and kind of the earliest ways that analytics can be beneficial for a healthcare org is getting everybody on the same page, right? So I'm sure this hasn't happened to any of our attendees or Allison, but for other people, I have heard it has been said that maybe one department doesn't know what the other is doing, or one region or one hospital doesn't know what the other one is doing, either successfully or where you're stubbing your toe, right? Analytics is kind of a great equalizer, because if you can get real methodical about sharing and distilling your data down to kind of those key metrics that are going to be most impactful. Think about the old kind of like Moneyball play, right? It's like, hey, we have all these stats in baseball, but are we winning more when this guy is at the plate or when this guy is at the field? Like that's what you're really trying to get to. Same thing with analytics. So there's an over-aggressive swing of the pendulum where maybe there's too many things out there and like you're paralyzed with how much data is present, but done correctly. Everybody's able to look at the same report or dashboard or visuals, and maybe marketing uses it one way, clinical operations uses it another, business development or site selection or market optimization uses it differently, but everybody is seeing the same things, and you can talk to one another, right? If there's a success somewhere, share that. Don't let people have to learn it the hard way like you did. Just share it across the org. If there's a failure, share it across the org so they don't have to learn it the hard way. And analytics is one of the easy, or I won't say easy, it's one of the direct ways to address visibility and kind of bringing down walls within an organization. Allison, I didn't know if you were jumping in there.
Yeah, I mean, I'm just thinking about, and again, look forward to some of the questions here, because I think there's a good dialogue to be had around this from a healthcare lens, health system lens, that we have no shortage of data in healthcare. I mean, we are drowning in data in healthcare. We have a shortage of information. And so to your point of how do you make it actionable, and how do you take, of course we have a lot of clinical data, but that's not what we're talking about here. We're talking about even, we already know who our customers are. We just aren't organizing our interactions with them through the lens of engaging them as customers. We're still organizing all the data in the lens of patients. And so I think as much as consumer analytics is additive in terms of helping you to better understand those people and how to communicate with them in a meaningful way and deliver what, meet their expectations, I also think it tells you where not to spend your time. And that's, been part of our journey is really using data to help us focus on the opportunities in front of us and letting go of some of the stuff that doesn't matter. And we can elaborate on that. And then just one other point I want to make, which I think is important from a health system lens, is that we started this journey with a decision to start. We didn't have a CRM. We didn't have consumer analytics at the time. We didn't have a lot of anything other than our own experience in knowing that we are all consumers on this webinar. we all want better healthcare for ourselves. We want it for our families, and we certainly want it for our patients. And so I think even just starting in the lens of consumer analytics can even be connected to things like patient experience, where we're already collecting that data. We just need to think about it differently. So I feel like, I just want to, I don't want anyone to think that they have to have all of these things in order to get started when you can really still make an impact.
Yep. So how do you start, right? So, go ahead.
Yeah, no.
You had mentioned, I thought it was great. You mentioned thinking about brands, thinking about consumers. How do you get started? I think, as we talked about, we'll show some examples of how you can start even today. But Allison, as we talk about thinking of your consumer as a brand, talk about some of the things on this slide and how, while we're not talking about a specific healthcare brand up here, healthcare is experienced in the same way, and the positives and sometimes the negatives. Yeah.
So health systems are very aware of the big tech disruptors, right, that we're constantly looking at, who's going to be dabbling in healthcare, who's going to disrupt us and try to take market share or, fragment the system, because there are certain parts of healthcare that are sort of easier to pick off, if you will, from a health tech perspective, but then where does the patient end up? They still need a health system ultimately. And so we're very worried about all of those things and doing things to try to make sure that we are delivering on what consumers want and kind of putting up the defensive moats. But we're also partnering with these folks, because there's an opportunity for us to learn and to grow together. And so not all of these logos up here are healthcare brands, although some of them are becoming healthcare brands in very interesting ways, right? So Best Buy is, stepping into healthcare. Dollar General is stepping into healthcare in communities that are really underserved. And so when you think about that from a DEI lens, rural America, there's some really interesting things that, frankly, health systems aren't really set up well to do. So how can we learn from what some of these brands already do with their existing customers, where they have a presence, and what some of their aspirations are. How do we marry those up and find opportunities? So I get to work on a lot of enterprise partnership activity in my role, and these are the kinds of things I think are really interesting. It's easy to be worried, but it's also easy to be excited because there's more we can do to serve patients when we think about what these brands are trying to accomplish. The other piece, though, is really just, we could put 50 more logos up here. There's so many consumer brands that are so good at knowing their customer. And their customer is not the same as the next brand, even their direct competitor. There are nuances, right? They're really good at knowing exactly who their customer is. And that was the biggest piece when we said we really need consumer analytics to understand this, is that as we stepped into retail healthcare, we got a really quick lesson in you can build a hospital on any corner of an intersection and people will come. You build a retail location on the wrong corner, and we all know that there's a lot of factors that play into whether or not that's the right corner and whether it'll be successful. And so we realized that just the way that retailers think about every little detail is different. And so it's not that we weren't doing all of those things. It's that we weren't doing it in the way that a consumer brand would do them. And so we had to really put on our consumer hat of what do I want, and then our consumer brand hat to say, and how would they meet that need? So I think Net Promoter Score is a great example of this, because I'm sure every health system on this call is doing some kind of patient satisfaction measurement, scoring. This is what we do in healthcare because we're very focused on quality. We want to make sure we're delivering on people's clinical needs, of course, and then there's some experiential pieces that are related to that. But we do that, and then we keep that data on our website or internally, or report it to various agencies or whatever we have to do. But it's no good if you have amazing quality and all these fabulous patient experience stories and scores if when I go to Google and look at you, I see no reviews and you're a 0. And so, we don't, again, going back to that consumer, I don't get the opportunity to deliver this fabulous care that we have if you don't choose us in the first place. So that's a component. It's something we had to start thinking about differently. And then Net Promoter Score is sort of the great normalizer, right? I mean, consumer brands all have a Net Promoter Score. That's how they measure themselves. So healthcare has started to measure itself with Net Promoter Score. And so we still do CGCAPs and HCAPs, all those other things. We still do all of the things that we need to do. But we started, translating everything several years ago to also a Net Promoter Score so we could benchmark ourselves and understand how does this relate to the consumer world.
You said,
yeah, I think it's interesting. Oh, go ahead, Nick. Yeah,
I say, I'm over here Allison, stop, because you're saying too much good stuff, and I won't be able to react. But no, that was all awesome and very pertinent information. I love this slide in terms. Allison mentioned some of these folks are creeping their way into the healthcare space. Some of them not creeping. Some of them are sprinting into it, right? Others of them, you talk about knowing yourself. Allison mentioned knowing where to not allocate resources or where to not spend your time. You don't see Walmart out here rolling out, a Louis Vuitton section. Walmart's a huge company and they're doing very well. You don't see Apple trying to fight to get into other markets that aren't kind of their core competency, right? So the ability to stay in your lane and have the data tell you that and be okay with it. So there's so much freedom in going, you know what, those specialties, we're better partnering with somebody because it's just outside of our reach, or it would pull us too far away from home base, right? We wouldn't want to alienate, kind of that core. Bill and I were talking not too long ago about Radio Shack, right? Tried to pivot. I think everyone I make fun of so many folks at our team where I'm like, okay, I'm going to first explain to you what Radio Shack was, and then we'll go from there. Right? But try and yesteryear Christmas time is coming. If my son comes in and asks for a remote car from Radio Shack, I'll be like, what have you been watching? But that attempted reach into named branded sales when it's like, hey, you you were already crushing it, selling white label goods and kind of being the small neighborhood store that everybody, you know, every kid wanted to go to for everything. Their logo is not on this slide now because of it, right? If we had done this webinar in the 90s, it would be up here and we'd be saying awesome things. So thinking like a brand and thinking of your patients as consumers can protect you from reaching too far, and it can also protect you from overlooking an area that you might expect to experience growth as well.
Right. No, I'm sorry. And I just say, you know, we'll move into some segmentation and some of that here in a second. But, you know, when you think about NPS, Allison, from a healthcare perspective, it's more than just that care, right? Yes, I go to see the doctor and there is that interaction, but I also made an appointment. Maybe I made the appointment online. Maybe I made the appointment through the phone system. I got into the waiting room. How long did I wait? What was the waiting room like? What was the follow-up like? How do I, you know, all those, what does your website look like? How easy it is to get information? All of those pieces, even if there was a fantastic care event, but something else went wrong, that affects your Net Promoter Score. And so you have to think about more than just the care and what do the quality of your buildings look like, right? And, you know, we joked about the American Airlines or any airline thing, right? You could have a great flight, everybody does their job, but you get to we've all had this happen, right? You get to the airport and maybe they're even 10 minutes early, but there's not a gate agent there. And now you're waiting 20 minutes and no one's talking to you, and everybody did their jobs right except one thing, and your experience was awful. Like, oh, I had the worst flight. I had to wait 30, you know, and so it is hard to do, but as you think about not just the care event, but all of those things that went into that interaction with the system, all of those things affect how they perceive you and why they make the choice the next time.
Right. So, I mean, you think about some of these brands, right? To that point, if I go to Starbucks and have a bad experience, I don't think all of Starbucks is bad. I go, man, I hate this particular location, or man, they just weren't on their game today. In healthcare, far less forgiving, right? So if they go and have a negative experience either digitally before you've even physically seen them or in the office, that might go quickly from a individual practice or individual location association to insert system name here, I don't like because they treat people this way. So with brands, you know, I'll you know, being a Texan and everyone down here, we're Whataburger fans. You have a bad Whataburger experience, you go to the next one because you still love Whataburger. You don't get that many at-bats when you're in the healthcare space, because people, especially now, as more people creep into it and it becomes more competitive, people are going to have options. That shopping cart image that Allison had up a couple slides ago, they're going to shop you. They're going to look somewhere else. So that ability to maximize that experience throughout the whole continuum is getting more and more important in the healthcare area.
And it's not, as we go, Nick, and just for sake of time, you know, kind of moving on, it's not just a one-size-fits-all approach to your consumer, though, right? Like, as you're figuring out, how do I talk to these people versus how do I talk to these people? They're all patients. I want to take care of all of them, but I need to care for them in different ways. I need to talk to them in different ways, and they maybe want to experience me in different ways, whether it's book an appointment online with these people versus I still want to call, you know, and people are using consumer analytics and segmentation to start to figure that out, correct?
That's exactly right, and this is something that, again, think of yourself as a personal consumer of healthcare, retail, restaurant, anything. This is something that retail, quite frankly, light years ahead in terms of applying this type of lens to looking at the consumer, right? You know, systems are all generally right now using some form of demographic information where it's, hey, our XYZ service line patient is this age, this income, you know, this housing value, which is good. There are certainly valid correlations between certain types of care or need and demographic information, so don't stop doing that. To Rob, again, from Allison's mention earlier, just keep going, go further. And, you know, this image that we have here is from a segmentation system that we use at Buxton. But there are many others, and again, it's more important to start and use something than to just use in any one particular version. But what you're seeing here visualized is each of these bars is a consumer segment. So everybody, Bill, Allison, me, everybody on the call, everybody that will watch this later, your household is in one of these buckets at any given time in your life. Easy orientation, that far left side, is going to be the most affluent homes in America. And then as you move from left to right, looking at those, you're going into upper middle income, low income by the time you get to the far right side. If you stop there, you're going to miss out on a whole lot of nuance, right? If it was just income, we would need maybe some quintiles, maybe 4 quartiles or something. But there are folks that have the exact same amount of money, work in the same types of jobs, that spend their money and live their lives very differently. And that, certainly for a retailer, that's what they spend their every waking hour trying to figure out is, okay, what is Bill going to buy versus what is Allison going to buy versus what is Nick going to buy. Healthcare systems are better served, and they're able to offer better service and drive more outcomes when you think of your patients the same way. When you stop bucketizing them in these big macro chunks and you start getting into the weeds of, okay, there are certain people that might be demographically very similar, but there's enough subtle nuance that I should either talk to them differently, expect them to engage with me differently. And I'll jump to a kind of a simple low-hanging fruit example here, but we're looking at 2 of those bars that I had on the previous screen, right? So on the left, this is, kind of going to be more to the left-hand side of what we looked at, and then that chart on the right-hand side would be a little further to the right. So think of this of kind of the maybe 1 or 2 jobs out of undergrad or doing your master's version of yourself on the right-hand side, the singles and starters, versus the engaged, maybe married, maybe a kiddo or 2 at the house, kind of in that left-hand block. Demographically, these folks are extremely similar age cohort. Think of any, we're fresh off of, kind of Election Tuesday, right? So the young voter or the young anything. It's like, well, really you're not saying the young voter or the young consumer. You're saying the consumers that behaved this way. Sentence follows. So segmentation can help avoid mistakes of, oh, young folks, they're not going to be a primary care patient. Or young folks, they're not going to consume or engage in certain service lines, when it's like, well, when in reality, there are people that are further along in terms of career, family planning, having commercial coverage, being more health conscious, that you could reach out to. And especially when we're thinking about being more holistic and 360 and having that full continuum of care, everybody here would acknowledge that the earlier that you get someone engaged and conscious about that health, the healthier a patient that you're going to be treating for longer and longer, more likely that they're not just going to be saying, hey, I'm going to be healthy and well, but let everyone here in my home not be. So there are so many implications to segmenting your consumer appropriately, whether that's by region, by facility, by specialty, you name it, that can help you make good decisions with service line optimization, good decisions with marketing, good decision with clinician-patient placement. So I'll come off of my soapbox now because you can tell I get excited about this stuff, but segmentation really gives you a lens to differentiate the folks beyond demographics. It's something that retailers have done for decades now and continue to be pushing the envelope, and we're starting to see more and more systems pick it up as well.
Yeah.
So, go ahead.
To build on this, so we today in Community Health Network use consumer analytics in a more sophisticated manner than we did when we started. But to your point, and this next illustration of just where did we start? How did this kind of factor into our entree into consumerism? Was really around site selection. I mean, we started into retail healthcare, and we partnered with a retailer to place clinics in the market, or begin to operate clinics that were in the market already. And in that case, we didn't choose always the building. The site was already there. We were choosing to put a clinic inside of a site. And so the first thing that we realized that was unique compared to any other site we would have otherwise had, because we typically as a health system build our own stuff. We build our own medical office buildings and hospitals and all those things. So being inside of someone else's space, the first sort of barrier, frankly, to us accessing a consumer was that they had to be willing to walk through that front door. And so if they weren't really attracted to that particular retail brand, then they weren't ever going to know or be willing, perhaps, to come to the clinic that was inside or co-located with that. And so the first thing that we had done, and again, we just started in a small space, and so this is a place where we think consumer analytics is applicable and that we can get our arms around, because there's lots more we can and still are trying to do with this. But we just said, let's understand who is our retail consumer who is interested in our brand and who's interested in that retailer, and do they match? It's really that simple. And so Buxton's got a really robust platform, obviously, with algorithms and proprietary models and all of those things. But it really boils down to this simple overall score. So we worked to create the model, and then we just score locations. And so with 100 being sort of the go, no-go for our benchmark, this was a location that was actually tested where, in the old school thinking of health system planning, it made a ton of sense when you looked at the physical location in proximity to the hospital, when you looked at claims data for the county or the zip code, when you looked at all those things that we typically do in healthcare old school, right? And still have to do, it's supplementary, but it was potentially a good spot. But it was going to focus on a consumer and deliver services that were much more consumerized, if that's a word, and it needed to appeal to a consumer segment. So when we did the scoring, we found out it actually wasn't that great of a site at all, and so thankfully we didn't go there. But the point was, we went and looked for a better site, but we could have made a mistake, in this, and without the data, we would have been fairly blind and thinking we were really meeting a consumer's needs when in fact we weren't. So there are lots of people who want to go into this space and probably need healthcare. They're just not people who want it from us. And that's okay. But at least we know now. So we don't waste our time. So, just a practical example of how we've used some of this.
Yeah, that's huge. Across every vertical that I've ever worked in, and it's just human nature, like the growth story or the we are expanding story is kind of the one that gets the most fanfare. But especially as we all look into the horizon and kind of look over at the 2023 and beyond, when things are more uncertain or when they're more competitive or when the stakes are higher, that's when you can have an even lower margin of error, right? So when you're in hyper-growth mode, you can make a decision and then play through it. But when you've got $1 to spend, and that's going to be the last one for a while, you need to be right. And so the ability to avoid a potentially costly mistake, arguably, and if there's any CFOs on the call, perhaps worth even more than making just one good, awesome home run decision, right? So it won't appear anywhere on the balance sheet because you don't make the decision, but it's just one of those things where every night you're like, oh, remember that time that we almost made that, it's just like we were able to not place this service line into this facility. We were able to choose to move a few blocks over. We entered a JV instead of doing it all internally. Whatever it looks like for you, analytics is really good, again, for helping you make awesome, great home run decisions, but also avoiding the costly pitfall that you're stuck with for a very long time and also precludes you from serving your patient base the way that you want to. Bill, I think you kind of started taking us towards co-tenancy there. There we go. And so this is another area where, as consumers, you're familiar with this, right? There's certain shopping centers that you go to or certain brands where you're like, man, why do I always see them together? Or why do I never see these two brands together? The study of co-tenancy, or maybe put more plainly, just who are your good neighbors, is something that the retail and restaurant space has, again, done for longer than healthcare and is kind of pushing the envelope further. The old school version of this in healthcare is why we have hospital districts, right? From an emergent or an ER care perspective, makes all the sense in the world. Get folks there, trauma triage, all of those things. From a sub-service line or service line or other specialties perspective, makes no sense. Especially with the way some of these major metropolitan areas are changing. So having a good grasp on who are your good neighbors, whether those are within the healthcare sector or, in this case, whether those are folks that are in the retail world, can be the difference between, hey, that was awesome, things are going well, versus you're scratching your head wondering where it's disconnecting. So co-tenancy, we'll kind of dive into. Were you jumping in there, Bill?
Yeah. Well, I know we're advancing for time, but yeah, I mean, I think that it's important. People will say, well, maybe for urgent care, maybe for primary care, but even for things like orthopedics, right? Sports medicine, and you don't have to have the provider referral anymore. It's, hey, knee pain, and so if I can use analytics to see, hey, there's a high concentration of people that are probably going to be experiencing this particular thing, and oh, by the way, they also shop at these places. And so when it helps with patient acquisition, right, because they're driving in the area, it's impression frequency, they're seeing the signage, yeah, my knee does hurt. Maybe they got a billboard above your location, whatever it is, you're marketing to them, and then they go, I'm going to at least talk to somebody in here, right? And that's how people make retail decisions. There's a number of different things that help factor in, and co-tenancy, it can be one of those things. But Nick, in a few minutes, why don't you take through some of the other things that you guys have with examples from community, and then we can have some time for question and answer.
Absolutely. So we'll hit the gas here a little bit, but this is kind of just one simple distilled example, just comparing a Target and a Kroger location in Indianapolis. And so there's kind of a few things that people are usually looking for when they think about co-tenancy. One is just traffic and volume, right? I want to be close to something or adjacent or nearby something that brings people to the area, and that's good. What is even better is how similar are those people to who I am trying to serve or would expect to serve, right? So it goes from just a traffic and visibility and volume perspective to, but are they ever going to set foot into one of my primary care or urgent care clinics? Are they ever going to make an appointment? And so this example here is using mobile data, so GPS data, to understand how far is the catchment or the draw of both of these locations. And so two fine brands, Target and Kroger, but we can see that clearly there are different pockets of the market that people are drawn to that area from. So this could influence things like, okay, where are we expecting people to be coming in from, or what communities are we trying to serve? That could influence who we co-locate with, because that's where those folks are already running their errands and living their everyday life. The next piece from here, just for time purposes, is getting closer to that alignment or that fit, right? So over on the right-hand side of this chart, you're seeing that the Target, in this kind of mocked-up example, is showing as being highly similar to a certain, subset of consumer, right? So there's the who's going to give me traffic and visibility and draw versus who's going to bring in people that are closely aligned with my specialty or with my brand as well. And both of those things can be considered either separately or together, and together they clearly lead to the best outcomes. Allison, anything from your own experience?
Yeah, I would just add, so this, as we've started to understand these trade areas, so number one, finding co-tenants, because again, we're realizing that as we become a health system that's focused on keeping people well, as much as it is anything that you're doing to respond to when they're not, you need to be in the flow of their lives. And so hospitals are not built in the flow of people's lives, to our earlier conversation. And so our ambulatory sites and, our total footprint of the market needs a market lens, and needs, the co-tenancy matters. We know that now. We try to locate ourselves in places that make sense, like you said, of the patient consumer who actually wants us or that we think looks like the patient who wants us. And so it's all of those factors, but it's also, there's implications here for location-based marketing. And so if anybody on the phone is from the marketing department, really I'm grateful to have, we just have an awesome team who has embraced this idea of moving to location-based marketing, which means that, and I think the go-to thing is like urgent care, retail care, but it's super relevant to every specialty as well because people want convenience as much as they can have it in every part of their healthcare journey. But the location-based marketing transitions that we've made in the course of consumerism adoption, if you will, has been to really, number one, actually, start the process of owning every Google My Business page associated with our location, managing your reputation management, doing all of those things so we can be found by the consumers in these trade areas. And then, of course, targeting our marketing really in a much more personalized way so that we're reaching the right people. I think healthcare does a great job of that big brand building stuff, that's the, number one in cardiac care billboard kind of thing that you see in every metro. But decisions are made on people's phones, and they're made by mom who's coordinating care for her whole family and doesn't have time. And, so we have to meet them where they are. And so this data really has helped us to understand where to focus, where not to focus, because in the trade area, if we live outside the trade area, it's so much harder to convince somebody to drive past what they view as a reasonable substitute to get to us. We need to focus on the opportunity in front of us. So it's about resource alignment as well.
Yeah, and real quick, when you have analytics that tell you that, if you guys want to go through the final few slides here to show you some of the outputs, the big picture outputs of what you can get with that.
Yeah, so this is that same graph that Nick had on a graphical representation, and this is actually those segments now lined up. And what you see as an example is just a mock-up to show you how we use this. But from a product line perspective, example of urgent care compared to a particular brand. So looking at who are the segments that they attract, who are the segments that we know, because we've done the work to understand it, are interested in these services from us. And again, do they match? So red being the best, blue being second best, and yellow being third. And then after that, there's literally no alignment. And so you'll see in pockets where there are cases where the hottest segment, red hot, being the number one for the brand, doesn't even rate. Like, we don't even attract that customer. and vice versa. And so it's finding that alignment that really starts, where this starts to click, and you realize how you can really meet consumers where they are using data to inform better site and service offering selections. And I think if I can maybe just jump ahead for a second to make this point. So this is an example of some different sites scored for different services within the same address. And so we have built now models for a lot of different service lines, so primary care, retail, urgent care, ortho, women's, and so on and so forth. And it's so fascinating, again, in this example, 100 being sort of our benchmark for go, no-go. A single site might be fabulous for a subset of these, but it's not good for another one. And so that's been really eye-opening for us too. And I think in healthcare we try to kind of put everything in one box, and that's maybe not the right approach, So we're rethinking some of those things. And this stuff takes time. I mean, we have legacy facilities, as everybody on the phone does, and how to rethink that to match what consumers really want has been informed much more by the data these days than it ever could be.
Yeah, I think that's great, and I think as we sort of wrap up and take some questions, healthcare is a very competitive environment, right? And it is you got for-profit players. Clearly, nonprofit has a mission to support, and there are some unprofitable pieces of this. And when you can leverage these types of analytics to help make the kind of decisions that you guys were talking about today, be it new sites, be it service line optimization, marketing, facility consolidation, those types of things, amongst others, it really can be the difference between you being successful in your mission and not, or generating quote unquote profit that you can channel back into supporting some of the unprofitable pieces of the mission to help the overall community achieve better healthcare outcomes. So, yeah, well, we could, again, as Nick said earlier, we could talk about this all day long, but I know we've got a time limit. So, Drew, we'll turn it over to you for some questions, but Allison and Nick, thank you guys. It was very good.
Yes, thank you, Bill, Allison, and Nick. We will now begin the question and answer portion of today's event. If you do have a question, please submit it in the Q&A box to the left. We'll answer as many questions as we have time remaining, and the rest will be shared with the speakers for follow-up offline. First question that came in here. We're gathering some voice of the customer, data across our organization, but a lot of it consists of benchmarking numbers versus human voices. What would you recommend, or have people have done in the past to get the voices versus the number?
Can I jump in? I really appreciate this question so much because we had a similar experience, and I would love to talk offline too, by the way. Always love the brainstorming around some of these things. We had a location that we wanted to open that was a retail-based site where we actually already had, it was a multi-story building in a downtown area, one of our first kind of true retail offerings, and we had to decide what to put on the first floor. And we had a bunch of ideas of things that we thought should go in the box. In healthcare, had at least done the work to score them and determine which ones really should go in the box. But it was completely new. We actually called it our concept store because we were trying to reimagine how all of this could work in a retail environment. And we didn't know what to call it. We didn't know how to, because we have these naming conventions in healthcare. A hospital means something to people. An urgent care center means something to people. But when you start getting into retail and you're offering new services and different combinations, we didn't know how to communicate it. And so we had all the typical things I think that this person's speaking to, but we actually did an experiential event, and I credit our patient experience team for really getting creative about that and just said, we need to hear the voices of the people. This is a retail space. People walk by it every day. They live and work in this space. Let's just ask them, And so we literally had this experiential marketing event where we deployed on site all day and took in feedback. We had a really fun interactive game to get people to tell us what made sense to them, what didn't make sense. So this can be really fun, but it was literally being side by side with the consumer to say, what do you want? Here's what we're talking about. We spent some time to explain it and got their feedback, and they helped to come up with a name. And actually, ultimately, what we did, if you're curious, is we ended up putting our tagline. So the building actually doesn't have a name. It says exceptional care simply delivered. And inside of that is all kinds of care. But it was a really cool experience, and it was, I think, very much coming out of the same thing that you're probably wrestling with, which is you can have all the data in the world, but you still want to make sure you really understand the consumer.
That's a great example. And I have one question I think would be good for Nick here. Nick, is co-tenancy related traffic and volume data easily accessible?
We'll define easily later, but it's definitely out there via a lot of different venues. If you kind of dip into the retail or the restaurant playbook, all of those brands are leveraging it. Some of them are kind of doing a kind of a home brew where they're just collecting it in their own service region or their own operating market. Others are partnering with a Buxton or folks like us to help, take that a step further. But it's definitely out there once you kind of know where to look. And I think we'll be sending some offline responses as well, so I'm happy to put a few more bullets. But the beauty of the co-tenancy data is that it is quantifiable, right? It isn't a qualitative, there's a qualitative component, but it is how many folks are there, what brands are they, what categories do they fall into. So for some of the more, kind of clinically or, zeros and ones inclined folks that kind of want to see things be, spelled out that way, there is an answer in terms of, do we do better around grocery or around big box? Or does it not matter? Is it just better to have the volume? So that co-tenancy journey is another good starting place because, again, it is quantifiable. It's something you can wrap your arms around, and there's lots of different avenues to acquire that data.
Well, great. Well, that concludes the time we have available for questions. In the next few days, all attendees will receive an email that will include a link to the archived webinar session. Thank you to our audience for joining us, and thank you, Bill Stinneford, and Allison Lewis Lodhi, and Nick Parrish for your discussion. Thank you again for joining. This concludes today's program. Have a wonderful afternoon.
Thank you.
Thank you.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.